Welcome to Emerge and Empower Podcast TV, a platform where resilience meets transformation. Here, we amplify voices that have faced trials, trauma, and adversity, stories that inspire hope, healing, and empowerment. Every episode brings raw, unfiltered conversations with individuals who have risen from hardship, embracing faith, strength, and purpose. Join us as we break the silence, uplift one another, and emerge stronger together. New episodes air Wednesdays at 6 p.m. English and Saturdays at 6 p.m. with select Saturdays in Creole for our Haitian audience.
Hello, and welcome. Welcome again to Emerge and Empower with Dr. Lynn J. Now, this is a Saturday episode, which I love. Saturday episodes are geared still towards empowerment, life transformation, and also our bilingual audience as well. So I want to give a little bit of me in different facades, right? And so Saturdays are set aside not only for bilingually, but when we have those transformation stories that are outside of the trauma that we discuss on Wednesdays, right? So if you're seeing this right now, this is from the Saturday broadcast, all right? Again, my name is Dr. Linda Joseph, and this is She Emergence, which is a part of the Emerge and Empower platform. When I say She Emergence generates from my own personal journey, and I've written 9 books to date. Yes, 9 books. The 9th book will be dropping in a matter of weeks, and it's a continuation of my transformation, my healing journey, and I bring it forth in different layers. But in whole, in order for us to be healed psychologically and also on a spiritual level, our bodies also need healing. Now, many of us have different health concerns, health issues, and today's episode is a special episode for you who are watching on today. And there will be many more to come to help you with your physical health. Right? We've been dealing with it on the supernatural and the spiritual health, soulish health, releasing hurts and pains. Well, also physically, you have to release these things as well. One of the things that we do is we detox, we take teas, we do whatever is necessary in order for the body to be well. To do all the things that you do, you definitely need to have a healthy vessel, which is you, your body. And you should keep this vessel clean. Detox, all right? Detox from words, from things of the generation that are passed on in your bloodline that is transferred, with those who have diabetes, hypertension, and so on. Well, on today, I have a special guest that will be coming on to share how we can get on the front row seat of our health, because our health is very important. I will be flowing between English and Creole. So be patient in this segment because I would like to reach both English speakers and Creole speakers. I am of Haitian descent, and it's only fitting that I bring something to you that can benefit my community and culture as well. Non, moi, c'est Dr. Linda Joseph, et ça, c'est plateforme qui relait Emerge and Empower. Les mercredis, nous parler sou moun qui te passé quelques bagay traumatique de la vie yo. Et puis, jodi a, nous choisi parler de santé, non seulement physique, mais mentalement parlant. So nou mande ou pou kapap pon pasyans avek nou, paske nan fe segment sa en anglais et en même temps en créole. Rele yon zami, fe yo konen ke ou konekte avec Dr. Lynn J. Jodia qui va faire une présentation sur santé.
Coffee was just Coffee? A routine sip, part of the 2 billion cups consumed daily, enough to fill an Olympic swimming pool every 3 minutes. Same old flavor, same old routine. For centuries, 75% of coffee drinkers have settled for mediocrity, masking the taste with sugar, syrups, and overpriced add-ons. But what if coffee didn't just promise to be amazing? What if it actually was? Introducing Alive Coffee, the first coffee that tastes as good as it makes you feel. Meet the coffee that thinks beyond the cup. Bold, smooth, alive. Made from expertly roasted top-quality beans, Alive Coffee is smooth, rich, and shockingly delicious. Stop drinking May, start drinking Alive. The coffee that delivers just like the 90% who won't start their day without it. Alive Coffee. Wake up, take over. Feel alive.
Feel alive. Yes, yes, yes. And today, welcome. We have Sandra Saint Eloi qui là ensemble avec nous aujourd'hui on Emerge and Empower. Let us welcome her. Welcome to Emerge and Empower podcast on today. I have a beautiful guest, and she's here about beautifying your health, all right? So that you can be a healthy individual and encourage you to be on the front row seat of your life. Now, the reason why it's only fitting as well is because she's here to talk about the health aspect. And this coffee that I was just talking about is all natural. There's no caffeine in it, and it's only fitting to just add that in so people will know we have some great products that are also healthy for you. So, Sandra, go ahead and introduce yourself to our audience on today.
Sure. Hello, everyone. I'm Dr. Sandra Saint Eloi. I am a nurse practitioner. Have been in practice for over 20 years. And my focus is on health and wellness, particularly addressing illness and chronic diseases from a root cause and trying to restore you back to your vibrant self. And I do this by encompassing different modalities, including internal medicine, hormone replacement, medical weight loss, with the sole goal of trying to help you not only age properly, but age well.
Wow, that is indeed key, and I would like for you to go ahead and say that in Creole because I already told them this is going to be a bilingual segment, so they just got to be patient with us.
No worries. So, moi-même, c'est Dr. Sandra Saint Eloi. Moi, c'est une nurse practitioner. Et m'a fait ça depuis plus de 20 ans. Et rôle, moi, c'est non seulement pour m'aider à rester en santé, mais le moi analyser ou le moi garder ou moi voulais que moi chercher cause pour qui ça gagne certains problèmes. C'est pas juste bon médicament pour lui, mais essayer résoudre problème dans cap causer et disease là. Et puis nous résoudre de là. So non seulement moi faire primary care, moi faire hormone, moi faire weight loss. Et but moi c'est non seulement pour nous grandir en santé, mais pour nous venir plus grand monde, but pour nous venir vibrant en santé en gamme.
Amen. I like that. It sounds so good in Creole. But again, we will continue with the segment. And as I said, we'll be flowing just so that we'll be able to reach a more international audience. Okay. So, Sandra, before we get into your why, which is now, can you briefly tell us about yourself and why this has become a passion for you?
So one of the things when I started my career, as a nurse practitioner, I was mainly working in the nursing home and seeing the amount of people who were so chronically ill, and the majority of them being women, and being on zillions and zillions of medication. That was number one. Number two, having patients come to me and really not feeling themselves, like, they just know that this is not the body they're supposed to have. Mm-hmm. But yet, I would look at their labs and say, but your labs look fine. Everything is quote unquote normal. And I'll see you soon. But yet I will see that look of defeat and frustration on my patients. So I started to dig a little bit deeper and see how I can really help my patients really regain their vital self, without having to go to 10,000 medications, and really understanding the cause of their problem and solving it from that point on. So that's how I started my journey.
Wow. So, konya napdi sa Creole pour moun kap gade.
So, raison que je commencé à travailler comme nurse practitioner, moi j'étais travailler dans nursing home. Et là, ou te kon wè paquet bon moun qui gen pile débilité, yo pas ka marcher, yo pas ka penser, et yon paquet de médicaments. Et c'est toujours mettre médicaments sur médicaments sans vraiment ranger problème qui fait besoin de médicaments ça. Et puis majorité moun qui dans nursing home c'est surtout filles. So filles en majorité c'est eux même qui fait population nursing home. Et deuxièmement, le patient m'était convenu, il toujours dit moi ça que il pas senti trop en forme, mais l'homme garder résultat yo d'après la science résultat normal. Mais tout bagarre en forme, so ma ou non 3 mois encore. En attendant, ou même ou vini ou sentir au style pour que sentir j'ont avlé pour sentir là, ou frustré ou déçu, ou pas joindre de réponse que tu as cherché. C'est ça que fait moi-même commencer à chercher pour quelle raison patient me senti comme ça. So à partir de là, vient commencer une journey of a wellness, functional medicine pour me non seulement aider patient yo, mais au lieu de juste ajouter notre médicament, chercher raison avec cause que yo senti yo comme ça pour me capable résoudre problème ça pour yo même yo ka feeling comme si dans optimal best yo.
Wow. Well, like I said, whenever we have make something our life mission or goal, it comes from a place because personally, once we discover it for ourselves, we like to share it. Mm-hmm. And that is pretty much what this platform is about. Everyone wanting to get in the front row seat of their lives, right? Whether it's from past traumas, whether it's health, maybe it was generational, and someone says, you know what? We got to do better. There's got to be more. Mm-hmm. And so I totally commend you and applaud you for choosing this way of life in order for the betterment, of the individual. Because when we feel well, we look well, we do better, right?
Exactly.
Like when someone l'église. So, l'organ bon santé, ou adowe pi bien.
Exactement. Au sens où fait tout bagaille tout.
Exactement. Au sens où fait tout bagaille.
Yeah.
Mm-hmm. Exactement. So let's briefly get into the journey and the world of this wellness and body transformation, right? So as you get into this genre and this space, okay, take us through what that's like.
So body transformation and really understanding, it's more trying to figure out the root cause of the problem. So for example, I went through my own personal journey. So I definitely understand where my patients are coming from. Meaning I was 50 pounds overweight. I've recently lost 50 pounds that I've been able to.
Congratulations.
Thank you. That I've been able to maintain. And when you go through the trials of life, you're tired, you're not sleeping well. You're thinking, it's stress, it's my workload. But all of that was a hormonal imbalance that I was personally going through. So by fixing that hormonal imbalance, I am feeling even better than when I was in my 20s. And currently, I can say that I'm kind of aging backward.
I love it.
Just by readjusting everything, and getting on the right path.
Right. So now we're going to flow pour mon créole nou yo.
So, une raison que moi commencé et body transformation ça, c'est parce que moi-même, moi te gen même problème yo. Moi te beaucoup plus gros que jamais connu, comme ça me pas capable du poids. So, moi-même, personnellement perdu 50 livres. Et puis, on connaît que l'heure ou fatigué, ou pas qu'à dormir, corps formal, mais ou juste penser que ok, c'est la vie, on connaît ma travail, ti moun yo là, un pile stress. Mais pendant tout le temps ça, c'était une question de imbalance hormonale que m'te gagné. Que moi vin ranger. Et peut-être ça, moi senti beaucoup mieux que l'homme de 20 ans. Et moi qu'à dire que c'est comme si m'a fait compte à rebours. Comme si au lieu m'a plus grand monde, m'a plus jeune.
Comment dit moi? Parce que c'est toujours ma pas apprendre créole. Comment dit moi? Compta?
Au lieu plus grand monde,
Compta rebou?
compte à rebours. Comme
Compta
si
rebou.
m'a fait back.
Okay, love it, love it. And so, again, for those who are just joining us and just watching, this segment is a bilingual segment, so we're flowing between English and Creole. So be patient, and once you hear the language shift, then take part in whichever one you understand mostly. But that's how this segment is going. Pour moun ki fè connecté, n'a parlé ni en anglais ni en créole. So pon patience et pratique pour ou, c'est li ke ou capable concentrer sur li. All right. So, what are some of the signs of hormonal imbalance? Often people overlook.
People, especially women, we think as hormonal imbalance are just hot flashes. You know, oh, I'm just sweating, it's just a hot flash. But it goes beyond that. And one of the reasons we tend to miss it, as I said previously, because of what we go through in life, because of the daily stressors. So we attribute it to life, you know, to the kids, to not sleeping well. So some of the symptoms could be a lack of sleep, or you just cannot stay asleep, or you don't have a restful sleep. Others could be like, no matter what you do, you're eating properly, you're exercising, you know, and you still are gaining weight and you have no idea where the weight is coming from. Or you have absolutely no libido. Your husband is there, you know, wants some affection, and all you want is like, you just want to kill him. He's like, get away from me.
Get away!
Get away from me. Don't touch me. You know, and the poor man. Also, brain fog, being unable to concentrate. It's like you're going to go in the fridge to pick something up and you're like, what was I in the room for? You know, anxiety, sudden panic attacks that out of nowhere, you're very happy. You have no reason to be depressed. And all of a sudden, you're very depressed. You're very anxious. Every little thing panics you. Having fluctuation in heart rate, heart discomfort. So those are all signs of hormonal imbalance that we tend to miss. And also the extreme fatigue. It's like no matter what, you are just drained physically.
Wow, I can say you're preaching to the choir, check, on a lot of those things. And I would say, oh, it's a hot flash. But I started feeling this much earlier than, you know, menopausal. I'm in that so-called premenopausal stage of my life. But yeah, we need to talk. You know, we need to talk health-wise for me. But for me, in my case, I deal with hypothyroidism, right? So I have highs and lows in my day, which is also still dealing with the hormonal. All right. So I pray that each and every one of you watching just paid attention. If you didn't get it, go back, because there are a lot of things that we are self-diagnosed. How you know you're having a hot flash? First of all, okay, you're not medically in that capacity to determine what actually is wrong. And based on what Dr. Sandra just said, a lot of it is hormonal. So you have to get all of that under control. All right. So now we're going to flip the script and we're going to go to our Creole audience on that.
So, sin ko imbalance hormonal, majorité fi pense que c'est juste hot flash, comme si vous êtes au chaud à transpirer, et pour penser c'est ça qui est ménopause ou bien périménopause. Et pourtant, là, elle est plus que ça. Raison qui fait que nous pas vraiment prêter attention à lui, surtout nous très occupés, n'a travail, n'a levé de monde, nous n'a kailan, so nous pensons que c'est juste la vie. Et pourtant, c'est beaucoup plus que ça. Par exemple, signes que nous capables pas réaliser qui sont signes de hormones imbalance, c'est nous pas qu'à dormir, ou bien ou commencer à dormir, rêver 3 heures du matin, quel que soit ça fait, yeux juste était ping li ouvert. Ou pas qu'à dormir encore. Ou bien, ou transpirer en pile le soir. Ou bien, ou peut prendre poids, ou qu'on mange bien, ou fait exercice, mais quel que soit ça fait, pour arrêter là toujours. Et puis surtout, c'est dans le ventre pour l'arrêter. Il n'y a pas aucun autre coton.
C'est vrai, c'est pas menti.
Dans le ventre là seulement. OK? Et puis, comme si, ou pas aucun libido. Ma ou vin mayon, ou juste la rale consommer. Pas moyen, pas garder même. OK? Ou bien, ou être déprimé, ou triste, par contre, pour qui ça, tout bagarre en forme, pour qui soit triste, ou anxieuse, ou gen des paniques attaques, par contre, pour qui ça. Joint a formal, comme si, ou était comme ça, genou a formal, mais on pas frapper genou. Épaules a formal, ou pas frapper les épaules là. Ou l'autre bagaille tout, surtout, j'en sorti avec thyroid problem, ou frette un peu comme si méon avec pio, toujours frette.
Oui,
ou quand mettez 10 000 chaussettes, les styles pas marcher. Vous comprenez?
Oui.
So, un pile petite nuance, et puis gagner là ou fatigué, quel que soit ça fait, ou pas capable, ou senti comme si, ou just drained, ou exhausted. Pas rien pour retirer fatigue ça. So.
Well, bien content on dit ça, spécialement pour pep haïtien qui a gardé dans la jodia. Parce que il y a des gens qui ont douleur qui viennent sous yo soudainement. Et puis, moun nan pa wè son bagay hormonal. Premier ba yi ta di son moun ki fè lon bagay. Yi gon douleur nan pied. I want to go there, m'vle ale la. Parce que en pile fois, nous dit c'est moun qui fait nos bagay et puis c'est quoi qui gen un bagay hormonal. Ou mettre le docteur, si docteur a pas checké, puis ouais son bagay hormonal qui gen, ou mettre boire toute graine qui gen tout. Ou pas boire, en pile fois ou pas même expliquer docteur exactement ça gen. Parce que pour même ou pas même vle di docteur, c'est ça, ou plutôt penser sur un monde qui fait. Par exemple, on nous dit m'a couru ça gen 200 ans de cela, moi t'aime gon boy épaule. Qui pomme. L'aime parler avec quelqu'un, c'est depuis arriver dans zone 40 yo, qu'on bagay qui les frozen elbow joint. Mais ça même pas qu'à lever main en lait. Vous comprenez? And of course, I could see it quand on a un monde capable de oh, gen la yo bon mauvais la main. Hein? Et pourtant, son bagay qui physiquement qui wrong en sa bavel.
Exactement.
OK, c'est ça que fait bien quand on dit ça parce que en pile symptômes ou dit moun nan pito bal crédit au moun qui fait on peut réaliser qu'on a un imbalance là-dedans qui la cause ça le sentir.
Exactement. Et je se dis frozen shoulder, c'est une signe que ou un problème hormonal parce que estrogène qui est une hormone que fille produit, c'est un anti-inflammatoire qui est extrêmement powerful. Vous comprenez? So là où nous pas gain, où le taux commence à descendre, so ça cause un pile problème joint. Et puis so toutes ces c'est symptômes que nous avons problème hormonal parce que j'aime t'as dit estrogène c'est un bon anti-inflammatoire. So là où taux estrogène a baissé, les causes d'inflammation dans joint, c'est ça qui fait toute douleur ça yo.
All right. So for those who don't know, we were talking further about symptoms, right? And some of the symptoms that also can happen when women get, beyond their 40s is like the frozen shoulder, which I had experienced myself personally, knee pains, different things in the body. And so Dr. Sandra was talking a little bit further on that in Creole. You can also now bring that into English explanation for those who are watching as well.
So Dr. Linda was mentioning that at one point she had a frozen shoulder where all of a sudden her shoulder was hurting. And that is one of the signs that we don't think about as being a hormonal imbalance because estrogen is a powerful anti-inflammatory. And when our estrogen level goes down as we go toward the transition into menopause, it does cause a lot of issue with joint pain, muscle pain. And I noticed you said that happened to you in your 40s. One thing that people don't realize is the average age of menopause is between 45 and 55. And
that's when it happened. I'm in between that gap of my life.
Exactly. And with African American women, we actually go through that transition even earlier.
Wow.
And women who have had hysterectomy even earlier, even if they have their ovaries in.
Wow.
And perimenopause, the signs and symptoms can start 10 to 15 years prior to us going through menopause,
Wow.
which means it's not unusual for a woman in her 30s to start having symptoms of perimenopause. So if you start having those symptoms, it's not in your head. You are actually going through that transition. And perimenopause is when all of our hormones are just like chaotic.
Mm-hmm.
It's like a roller coaster ride. So 1 minute you're fine, you're happy, your mood is good. The next minute you want to kill somebody. And it's not that you're a bad person, but those are the physiological changes that are going within your body that is causing those symptoms.
Wow. Well, I'm glad you said that, because most people think, oh, those are old people pains, certain things that happen. Those are old folks pains, you getting up there. But I'm glad you went that far as in the 30s, because some symptoms I did start feeling early in my 30s. I discovered I was first hyperthyroid, right, in my 30s. It's been 18 years now. Okay. And so I'm heavier in my life now than when I was childbearing and carrying children and all of that. Pregnancy and all, my weight now is more than that, okay, due to the thyroid. So that's why I watch what I eat, etc. So I'm glad you mentioned the age thing, because a lot of people think it's a particular age group.
Correct, which it's not. So us being like 30, 31, 32, we are not exempt, definitely not exempt. And hormonal imbalance doesn't just focus on the sex hormone like estrogen, progesterone, testosterone, also thyroid, cortisol. Those are all hormonal imbalances. So the key is to be able to recognize those signs and symptoms and to seek the care of a provider who is in tune with that as well.
All right. I know a lot of y'all probably said, I need to talk to her. I need to talk to her. The link and all of that is in the bio, so you'll be able to reach her, okay? And she'll be able to even talk to you virtually as well, okay? So she'll be back. This will not be the first time, so be patient, because we're going to be dissecting a lot of different topics. Today, we're just doing an overview, so tune in every Saturday, okay? Tune in every Saturday. So let's continue with the hormone journey, right? So how can hormone therapy help restore balance and confidence?
So think about when you are feeling well, you are feeling your best. It's like you are the queen of Sheba. So that's what hormonal balance will do for you. So taking you out of an imbalanced state and fixing everything that is going on physiological and restoring that balance will bring back those systems back into place where they need to be. So somebody who feels at their optimal best, you sleep better, you look better, you feel better. Therefore, your outlook on life is by far better. You're losing weight now because whatever was happening before is shifting. So you get that balance back. So that's how it all comes into play. And you're feeling your optimal self again.
All right. So now we're going to switch over in our language.
So, le hormone bien balancé. Imaginons, le senti bien, ou senti en santé, ou ka attaquer n'importe qui ça qui vient devant. So, le prend hormone ou balancer yo côté que tout système yo a marché, jan yo supposé marcher en accord ensemble, ou dormi pi bien, ou gen plus énergie, ou commence à perdre du poids, ou paraît ou plus belle, ou et comment ta dire ça, comme si que ou glow, ou comprendre ou illuminé, so ou senti ou en forme. So comme ça ou gen énergie, ou gen confiance pour attaquer n'importe qui ça la vie ba ou encore.
mais faut moun nan pot aller dans traitement pour ça. C'est pas seulement un
Exactement.
bagay changer pensée ou, mais style la vie ou genre manger, et faut aller à un monde comme ou même qui
Oui,
capable guider yo dans santé ça, dans pathway ça, dans marche ça, qui capable aider yo, capable vivre yon la vie qui pi en bonne santé.
exactement. Parce que de là où on commence à get des signes, faut chercher un healthcare provider qui gagne connaissance pour capable reconnaître certains bagailles. Parce que j'aime dire là, l'homme de commencer, l'homme a regardé un test laboratoire en passant, moi, je pense, OK, tout bagaille en forme. Tandis que femme te chercher plus deep toujours pour me exactement pour me chercher exactement qui ça t'a passé pour me comprendre qui j'en pour manger li.
All right, merci bien. And so now let's go to how does medical weight loss differ from typical weight loss programs?
So with medical weight loss, there are a few key points. A medical weight loss is clinically supervised. It is based on your individual labs, your own metrics. It is tailored just for you. And you get access to FDA approved evidence-based medication when necessary. Whereas it takes you on a journey and identify different paths that could further impede your weight loss journey, whether it's a hormonal imbalance or is it an issue with gut health. It looks deeper as to the reason why you're having that issue with your weight. Is it a thyroid issue? Whereas the typical weight loss, it's concentrated more on calorie in versus calorie out. You usually have coaches that may not be medically trained. You may not have access to medication. It is usually like a one-size-fits-all model versus being individualized care. It may not be based on your labs or your specific matrix. You may not have access to prescription medication. It may be on a point system. It may be a meal plan. It may be too restrictive. It could be like a fad diet. It may not be sustainable. Whereas with a medical weight loss, you are being taught the tools in order not only to achieve your goal, but to put you on a path of sustainability.
To maintain.
Exactly.
All right. So, qu'on y a un petit ça en créole.
So, différence avec un medical weight loss contre ou just un weight loss program, medical weight loss là, ou gen un docteur, un nurse practitioner qui spécialisé là-dedans, cap guide ou. Non seulement ça, li individuel pour même seulement. Comme si d'après test laboratoire ou. Et non seulement ça, li essayer garder puis plus à cause qui fait qu'on pas perdre du poids. OK? Est-ce qu'on a un problème hormonal tout? Est-ce qu'on a un problème thyroïde? Tandis que weight loss qu'il a en général, c'est plus compter calories et compter points. Ou gen doit un coach, mais coach gen doit pas gen medical training là pour le guider. Les plus one size fit all, comme si même plan qui pour personne A, même plan ça, c'est pour tout le monde. Tandis que les supposé tailor. Et les gen doit comme si c'est juste résultat rapide, mais qui pas durer. La minute ou fini, ou reprend poids encore. So gen plus yo-yo effect là. Tandis que medical weight loss là, yo bon outils qui pour aider ou non seulement rive dans bureau, mais tout pour kembe résultat.
C'est vrai parce que en pile fois ou essayer le quelque pareil mon y a fait online ou commencer prendre là pour commencer sortir pardon 10 même 15 livres même. Mais après le regarde un mois ou retourner même quand tu commencé à. Parce que ça arrive. You know. So and I said that in Creole, I was saying in English, many times we try different things that we see online because somebody said it on TikTok or somebody said it on Facebook, on social media, and we go and try one of these, dieting thing,
Mhm.
and maybe yes, we do lose 10 or 15 pounds,
Mhm.
right? But then it comes right back on. There is this big thing that's new that everybody's doing is I think it's the GLP-1.
Mhm.
They're trying to get this, or it's the diabetic I forget what that one is called, the pill to
Mhm.
help curb the appetite and cause people to lose weight. So people are going through all these extremes in order
Mhm.
to lose the weight, but then also are causing other issues in their body.
So when not done properly, it will definitely cause issue. Like the GLP-1 medication or FDA approved evidence-based medication that do work. But just taking it, let's say, okay, I find someplace online that will sell it to me, so you're just taking an injection. Yes, it will curb your appetite. Yes, you will lose the weight. But what people don't realize, done improperly, you lose a lot of muscle mass. Because
Yes.
the first thing that happens when you go on, especially with rapid weight loss, is muscle waste, muscle
Mm-hmm.
loss.
Mm-hmm.
And you will see those people, yes, they do lose the weight, but they look sickly. They look older because everything becomes flabby.
Yes.
Whereas when you have the guidance to do it and the proper tools in combination with the GLP-1s, you get better results and you are taught how to preserve your muscle mass and you have more sustainable results. So you're not on a medication for the rest of your life.
Yeah, and because I've seen people say like they lose their hip, they lose this, they lose
Exactly.
that. Yeah. So
Yeah.
me, I read everything and whatever the symptom says it's gonna do, I'm like, never mind.
But you have to do it properly though.
All right, I know this en Creole too, parce que nou konen nou an pil nan moun nou yo kap di pon sa, me sa l fe pou nou, an nou pale sou GLP-1 sa, ke tout moun, se kom si son bagay ki yon nou trend konye, on nou steal.
Exactement. So GLP-1, c'est pas comme tu penses si c'est un mauvais médicament. Parce que médicament comme Ozempic, Zepbound, yo FDA approved, yo gen évidence qui montre oui yo marché. Mais en pile moun ça yo fait, you can acheter une compagnie online, you just order medication et puis yo prend injection. OK, oui, ou perd du poids, ou la empêche ou manger,
Oui,
mais ça moun pas réaliser, l'on perd du poids, ou perd du muscle. Et ça fait ouais, figure tomber.
oui,
They yo ale.
oui.
Ou kompren? Ou kakou moun ki malade, non seulement ou perd du poids, ou perd du poids, mais on paraît 10 ans plus âgé que l'autre gen poids.
C'est
Parce
ça.
que j'ont perdu là.
Mm-hmm. Mm-hmm. It's true. So we just, because this aging thing, I've seen some people like, what? You look better. You might as well have kept them pounds on, you know?
Exactly. Exactly.
And not everyone, I'm going to say this in a sense of your physique.
Mm-hmm.
A lot of us, naturally, God created us in a structure,
Mm-hmm.
right? Physically speaking.
Mm-hmm.
When we go and we alter that, okay, we totally look different.
Mm-hmm.
Whether it's to weight loss, whether it's to whatever it is we're doing, we no longer look a natural self.
Mm-hmm.
And I have yet to see people who actually, in doing, look better, especially when it comes to weight loss, because you did it wrong, so it dreams you. You look aged. Some people look 20. You said 10? You're being mild. Some people look 20 years older.
I know that is so true though. It is so true because you're doing it incorrectly.
Mm-hmm.
You have to have the proper guidance to do it. Everything, if done the wrong way, will cause more harm than good. And there are some
Yes.
side effects that you may have from those medications also. And not everybody is a candidate.
Right.
So that's
Right.
what people need to realize.
That's true. That's true. So this brings us to our next question about what should someone know before trying body contouring?
So before trying any kind of body contouring, one thing you need to, number one, if you are pregnant, breastfeeding, that is not a modality for you. Okay. If you have any metal in the area that you want to treat, or if you have any kind of implantable devices or any surgeries, you are not a candidate.
Mm-hmm.
And what people need to realize, body contouring, while it works effectively, it is not a weight loss measure. But what it will do, like what we carry in the office, it will help you not only lose fat, in addition to losing the visceral fat, which is that fat that is around the organ that causes high blood pressure, high cholesterol, diabetes, but also it will help you gain muscle mass at the same token, where it works. So it changes your body composition. So the goal is to lose the inches where you want to lose it, but at the same token, do it in a proper way and build your muscles at the same time.
Right.
Exactly. So, and it's the one thing people have to understand, it's not only it's non-invasive also, and it's gradual. You're not going to be like from 1 minute to the next.
Not overnight.
2 inches. No. And maintenance is key. What do I mean by maintenance? A proper diet. Exercises. Yes, you have to exercise, because let's say I take the fat away from you and you go eat a burger. It's basically you washing your hand and you're drying it in mud. Simple. So I always tell my patient when they are with me, it's a partnership. I do my part, but you also have to do your part.
Right. Right. Thank you so much for that. And now we're going to go into Creole.
So body contouring, konen lò tan kou bagay device ki la ki pou fò perdu inches. So gen de bagay pou konen an van ko fè n'importe nan procédure sa yo. Sou anset, si wap bay tete, ça c'est pas un bagay ki pou fèt pou kounye. Si par exemple ou gen un pacemaker ou gen métal nan zone côté que ou pa ou vle traité a, c'est pas un bagay pour. So fait opérer, c'est pas un bagay pour. Et ça pour nous comprendre tous que c'est pas une modalité pour faire nous perdre du poids. La fois perdu pouce comme si dans ventou ba ça yo, la fois perdu inches, mais il pas là pour faire perdre du poids. Modalité que nous utilisons dans office moyen, non seulement li retirer graisse là, mais li augmenter muscle, so li changer composition corps. Côté que tout marcher ensemble, côté graisse a baissé, muscle monté, so ou ka joindre physique ou ap chercher. Et puis faut maintenir tout. Si par exemple, ou vient faire traitement, ça et puis ou al manger un hamburger, c'est laver mes suer à terre. OK? Parce que faut maintenir non seulement faut manger bien, faut manger proprement et faut faire exercice surtout. J'aime si passer mieux leur vin joindre moi-même avec son partnership que nous gagne. Moi fait partie pam ou fait partie pour cap gain résultat que vous chercher.
Well, hamburger pas fait pour nous, non, c'est griot avec.
Mais quand moto qui je vous fais griot pour pas toute bonne graisse ça là dedans non plus.
I don't think c'est griot, am connais que mon qui dit moi balade. C'est au petit hamburger m'pa manger by ça yo. Mais n'a parlé de griot, n'a parlé de fritaille.
De fritaille là.
Fritaille là. So ap manger ou connaît qui pas bon pour moi. So c'est sous li n'a parlé macaroni au gratin, gon l'autre façon qu'a fait. OK, n'a parlé pour même qui a ici parce que me connaît ou pas do ou pas manger hamburger by ça on balade yo mais ou gen l'autre bagay. Actually griot ou ka comparer griot a Jean fait la préparer la plutôt son hamburger ou te manger oui.
Exactement.
OK, so
parce que griot a moi même petit griot tout. Mais faut qu'on y ait des gens pour changer manger pour aussi un bon goût avec authenticité cuisine haïtienne mais qui pas aussi malsain.
All right, so we had to get culturally into our food.
Oh, yes.
Because she mentioned the burger before, but see, our Haitian culture, they're not big on burgers, okay?
No.
If you know Haitian food, it's about the griot, the pickles, like y'all say it, okay? These are the foods that are very fatty, and there's a way to cook, cook healthy, all right? Cook healthy, all right? So we're going to get into the lifestyle, okay? All of this that we've said, you have to want to change your lifestyle. Anything in life, when you have a goal set, you got to change your mindset and you got to shift things. So as she took you through all these modalities that we need to do, well, you need to change your lifestyle. All right. you got to renew your mind. The Bible tells you about renewing the mind. Everything that we're doing, you have to renew your mind. You have to want it bad enough. For some people, it is health. The doctor have you do it because your health, your life depends on it. Okay, so you got to eat to live and not live to eat. There's a difference between the two. Eat to live and not live to eat. Okay, some might say I'm already fasting. Like me, for example, I'm not a big eater. I'm not big on breakfast. I might have a cup of coffee, something. I'm more a brunch person, right? That's my biggest portion in my day. But there are times where I'm so busy all through the day that I don't eat something until maybe 6 p.m. or even later. At that time, once I've eaten, it's like, what did I just eat? Because it's like I need more. I don't feel full. And then you were eating empty fillers, okay, at the end of the day as well. So let's talk about the lifestyle changes and supplements technology wise.
So with, let's say, a weight loss journey, lifestyle is 90% of what you need to do in order to get to your goal.
Mm-hmm.
And like you said, it is a mindset shift. Okay. And as we were talking earlier about the Haitian culture, the Haitian cuisine, I enjoy my Haitian food.
Right.
But I taught myself how to cook it differently, where I still retain my flavor and yet still be a little bit healthier.
Yeah.
The goal of any journey you embark is consistency. Consistency is key. And yes, taking a medication will help you reach your goal faster. But during that process, you have to be willing to change certain things, because otherwise, the minute you stop, you're going to go right back to where you started. Mm-hmm. So whether it's healthier eating, whole food eating, exercising, movement is very important.
Yes.
Mm-hmm. And supplement. I use supplement in order for us to obtain the nutrient that we normally do not get in our food.
Yeah.
Unfortunately, in the United States, our food is not the best.
No.
And it is devoid of any kind of some of the key nutrients that our body needs in order to thrive. So with my program, it's a combination of lifestyle changes, supplementation to have the proper nutrient, and technology. Like I was describing before, one of the modalities that I have is the M-Sculpt Neo. So we help you remove some of that fat and build your muscle at the same time, so that while you are going through your weight loss journey, not only you lose your fat a little bit faster, but also it helps you preserve and maintain that so important muscle mass that we need. So it all intertwines.
All right. So we're going to go over to Creole as far as changer, non seulement penser, mais style de vie. Mm-hmm. All right. Pour bagay sa yo ka fait, faut ou même ou fait partie par la donne. C'est pas seulement boire yon médicament pour ou sou ka perdre poids, mais ou ap manger jan vle. Nous toujours parler, et apôtre Paul toujours dit ça, il dit pour nous renouveler pensée nous. Tout le temps ou pas renouveler pensée ou attitude ou à ça ou besoin ou pas qu'à achever son taremea. So c'est dans ce sens ça que nous t'a parlé là, et Dr. Sandra parle expliquer ça puis plus pour vous-même.
So lifestyle là, là commencer non comme si un pèlerinage de weight loss pour perdre du poids. Faut changer façon de manger. C'est pas juste pour un médicament qui retire appétit et pour continuer à manger même genre. Mm-hmm. Faut comme si éliminer un certain de bagailles pour capable achever et bu qu'au besoin. Surtout et manger qui sain, qui pas gain graisse, ou essayer d'éliminer sucre, mais une qui élément qui est essentiel yo faut consistant. Oui. Parce que si pas consistant, on peut retourner même jour de commencer. So faut kembe là. Et en plus de ça que moi montre qui j'en pour faire, nous avons certains suppléments qui complètent nutriments que nous pas jeunes dans manger nous. Parce que malheureusement aux États-Unis, manger pas aussi sain. Si par exemple, ou entre en Haïti, ou en province, ou manger un poule avec banane,
Oui.
ou manger même poule à banane ici,
Oui.
il pas fait même effet à
Non.
sou.
Non.
Ouais, ou sont totalement différents. Parce que pour gens manger ici, so, c'est ça qui fait que nous recommandons une série de suppléments pour capable de nutriments que le corps a besoin. Et en plus que ça, il y a l'autre modalité technologique que nous avons dans l'office là, qui aide en plus pour retirer graisse là, qu'on cherche à retirer, et qui aide au kembe muscle supposé kembe. Parce que une barre qu'on perdu, là on a perdu poids ou perdu muscle. So, là, combiner tout ça ensemble, li aide à achever but qu'on besoin le plus vite que possible, mais sainement.
All right, merci en pile. So, moi-même, moi pas seulement parler de ça, parce que moi-même, je pas joindre avec Dr. Sandra, parce que nous-mêmes qui connaissons longtemps avec Konya, nous, c'est des mondes différents, parce que nous sommes minces, etc. Et puis tout le monde dit, mais go say à l'avant, c'est da. They love to say, go say à l'avant, c'est da, mais c'est da pas senti les comme forme. Par exemple, quand certaines talons qui quittent de qu'on mettait, à cause des poids, je me sens dans le génome, ça vient faire que je ne pas mettre au haut terme, obligé de descendre un peu. Vous comprenez? Mais je remets pour me continuer même style, ça, que je gagne. So, faut me joindre avec Dr. Sandra. Quand il y a là où mon corps pour où je dis, oh, God, they miss on me. Vous comprenez? So, exemple, ça, là. So, we're going to go through it, okay? I was saying in Creole, I will go to her and you'll see the change and transformation in my life as well, because I've been looking for something that work, right? We all have tried things to see if it worked. I remember I took the shot. I was at the doctor office. They said, don't eat this, don't eat that. I was already eating healthy as a person. They was telling me, don't eat bananas, don't eat this and sugar. And a lot of these things they were telling me not to eat. So basically they told me not to eat because I was already eating healthy. I don't do fried foods. I don't even fry food in my house. You know, my food is either sauteed or baked, you know, and I don't do fatty stuff, right? But still, the weight was there. I lose a few pounds, but then it came back because it was my regular thing. My weakness, though, is my bread. I don't know. We got to do something where I can still eat my bread. Because bread is my thing. It's not the rice, it's not all of those things, but I love my bread. Okay, I love bread. Someone heard me love bread so much that she got me a bread maker so I could make my own bread. So I know Dr. Sandra's going to give me recipes where I can have a heart healthy bread. Okay.
We're definitely going to talk about that.
Absolutely. Yes. So Dr. Sandra will be back, guys. This is just a segment of many to come, because as we are telling you to heal psychologically from past traumas and pains, we also want you to have a heart healthy life. All right. We want you to be able to enjoy life. What's the point of doing all of that and you still not on the front row seat of your life, health wise speaking? Because your health is very important as well for your thought process. All right. So we will continue. And remember, this is Saturdays, okay? Not your typical Wednesday segment, because when we come to you, we want to come to you as a whole. My segments are not focused just on one particular area, but I want to see you as a whole from start to finish to ensure that you're continuing this journey of healing, because healing is continuous. We learn every day, right? We learn. Like, for example, my granddaughter came to me one day and said, Grandma, do you know we've been peeling the banana wrong? I'm like, what do you mean? She said, we've been opening it the wrong way. That's upside down. You learn something new every day.
Every day.
Okay, I learned it from my parents because that's how they did. I said, well, we've been doing it wrong for generations. Okay, so we learn something new every day. And so, Dr. Sandra, I truly want to thank you today for your time, all right, and your yes, all right, for your yes. And she will be back, and I'm sure there'll be other colleagues that she know about, because this is about you living your best life possible. All right.
Yes,
And your
amen.
health matters. So thank you everyone for tuning in with us here for Emerging in Power. Until next time, everyone. Dr. Sandra, let's say
Bye-bye.
bye to everyone.
It was a
Merci pour tout le
pleasure.
monde qui t'a regardé. Nous n'a
Merci
tourné.
beaucoup.
Dr. Sandra pas seulement là pour aujourd'hui, mais n'a tourné presque quelques samedis, puis devant toujours, et continuer tourner Partagez nan groupe pou yo, parce que nous connaissons nous dans WhatsApp, nous dans tout bagay, et bien, on nous suivre channel ça. Merci en pile, et à semaine prochaine.
Au revoir.